Tons of people use cannabis for anxiety. Today, we're going to give you our best suggestions for using cannabis for anxiety. Welcome back to Discover Marijuana. I'm Tim Pickett, here with Josh Fitzgerald, clinical pharmacist at Deseret Wellness Cannabis Pharmacy, and we're talking about anxiety. Now, anxiety in Utah is not a qualifying condition for a medical cannabis card, but something like 85% of cannabis users across the US report using it for anxiety at some point in time. And it's really important for PTSD patients because anxiety is such an integral part of that mental health condition. What is it about anxiety that can be helped with cannabis, Josh?
Anxiety is kind of one of those things that just comes on randomly in certain people, and cannabis is really good at acting very quickly. When we talk about, treating anxiety with traditional medications like benzodiazepines,
and that's really what we're talking about, right? This adjustment, or that's really what we're moving away from the benzodiazepines. Towards something that's a little safer.
Yeah, that's what our patients are here for. They're here to maybe, use less of their benzodiazepines and substitute that with cannabis. Benzodiazepines take a long time to start working. When you're having an anxiety attack of any kind, you need something that's going to be able to work right then and there to control that anxiety. And they also want something to help kind of mitigate anxiety attacks throughout the day also. So cannabis is great for that. Cannabis in inhalation forms works extremely quickly. You can stay on top of that anxiety attack and treat it for long periods of time too. So transition into a tincture of some kind that's going to give you a prolonged action of the cannabis to control your anxiety.
What is cannabis not good for in anxiety?
At high doses, cannabis can trigger anxiety. And so patients that are prone to having anxiety attacks, we really caution them and guide them through the process on dosing it correctly so they can avoid that.
So do you recommend patients start at some level of THC that's pretty safe and then work up?
Yeah. Yeah, definitely starting at a low dose. We talk about like 2.5 milligrams as like a beginning dose. Very small inhalations with their vaporization methods, to kind of find the right dose that works for them. And then as you become familiar with it and know how it works within your body, you can increase that dose to help prevent and control anxiety attacks.
Are there cannabinoids or terpene profiles that are more beneficial for anxiety and this type of thing?
When we talk about strains and cannabinoids and stuff like that, we want to make sure there's lots of CBD there because CBD is going to help kind of control that THC from getting you to a psychoactive or an anxiety point. So lots of CBD, and then we add in the THC too. So tinctures are a really good option. Strain-wise, we want to look at something that's more of a sedating strain, like a hybrid or an indica. Going with something that's got more of like a pinene or an earthy tone to it. You're going to have a little bit more sedation properties with it. Whether you're using like sativa that's going to be more stimulating, that can actually throw people into an anxiety attack, or the anxiety will get away from them.
Do you have products in there with CBN? Because we understand that CBN is something that's on the rise for anxiety and relaxation and things. Have you seen products with that cannabinoid?
CBN, it does come in some of the tinctures that we have. And so I recommend people kind of staying with the tinctures and going that route with it, yes.
Cool. Talk to me about a sample regimen for cannabinoid therapy. Say if I come in and I'm a patient with PTSD, so I have a qualifying condition, but a lot of that is anxiety triggering that.
Yeah.
How would you start me off?
So we talk about, when are your trigger times really with anxiety? A lot of times people have anxiety at night and they're not able to sleep very well. And so we're going to talk about edibles with them and using the edibles to get really good quality sleep to better deal with their problems during the day and mitigate some of that anxiety during the day too.
You're taking the edible about an hour before bed? Or
a couple hours before bed. Yeah, and let it kick in and start working. If they have any issues beforehand, they can use the faster methods that don't last as long, like vaporization methods or even some tinctures too. During the daytime though, we want to make sure that they've got a vape on hand 24/7 because when you have an anxiety attack, you need something you can go to immediately to stay on top of it and help yourself through that period.
And that inhalation, that really the vape cartridge is the quickest acting.
It is.
It doesn't take a lot of preparation.
Super portable. Take it wherever you need to go.
Very discreet.
Very discreet, yes.
When it comes to using flower though, is there temperatures that tend to be better than other temperatures?
I always, for a general rule, just say start with 300 and kind of go up from there and don't get in anywhere past 400 degrees. But that's dependent upon the person too and what they like and the cannabinoids that are in this. One, the strain that they're using, and two, the ones that they prefer. And so it's kind of a lot of trial and error. But don't get in past 400 degrees for sure, I would say.
And make sure that you're not overdoing it. If you feel pretty good at one inhalation or two, that third can cause that anxiety response. Yep. And so I think it's important to make sure that you find where that dose hits the just right dose, as we call it in our dosing guide. And then
Mm-hmm. Yep.
If you have a regimen or something that you're using for anxiety, please comment below. We want to hear about your experience using cannabis for anxiety. I think that the more we talk about it, the better we all are. Now, as far as tips and tricks, it sounds like keeping an inhalation method with you, yes, or available for those triggers sounds like something that everybody should. If you're using cannabis medicinally, then that's a good idea.
Yeah. We also have sprays and stuff that you can use too. So sprays are very discreet methods for dosing, and oftentimes you're not in a situation where it's appropriate to be vaping, and sprays are a good discreet option to just.
And those are sprays that go under your tongue. They take about 20 minutes to take effect.
And they work for a couple hours usually, and so that gives you a really good time to kind of help in that situation.
The nice thing about those here in Utah is they're low doses.
Yes, they are.
So I know Boojum makes a product that's 2.5 milligrams per spray. Yep. That's a perfect low dose to just get it on board. And
there's different terpenes in those sprays too that you can use at different times of the day to help in specific situations too.
Oh, perfect.
Yeah.
Remember to always talk to your provider when you're coming off of any other medications, especially benzodiazepines, because they have some withdrawal symptoms and you want to be managing those with your pharmacist and your qualified medical provider. When we talk about temperature and using cannabis for anxiety with temperature, why do we want to keep that in that low temperature range?
So as the plant is smoldered within that vaporization device, at the lower temperatures, you're going to get more of a CBD profile to it, more of those lower endocannabinoids. When you get up into the high range, you're getting more of the THC delta 9, especially in anxiety. That can trigger anxiety attacks or prolong anxiety attacks. So you want to stay at the lower end.
So kind of a good idea for Utah to eliminate flames and combustion.
That's why we do it.
In essentially to keep that temperature down, using those other cannabinoids for medicinal reasons.
Exactly. Yep.
Talk to your pharmacist and your licensed medical provider when you want more information about how to use cannabis for anxiety. Subscribe, as we are going to talk about, and we're going to release videos on conditions and the tips and tricks for IBS.